So in terms of infections, over the last 24 hours, we've had about 67 new cases, and we are 62 rather new cases, and we are currently monitoring 514 cases overall. But again, while this looks as if things are normalizing, we are not seeing a lot of people coming forward to get tested, and if we don't test, then these numbers are going to be artificially low. So that's a caveat that we have to think about. But right now we have 62 cases over the last 24 hours. In our hospitals, we have 15 cases, and at the Ocean View facility, we've had 12 cases there with two persons in the ICU. In terms of vaccination for first and second dose adult, we have completed 445,322 doses. That's 86.8% of our adult population. Second dose, we are now at 344,941 doses. That's 67.2% of our adult population. In terms of persons between 12 to 17, we have now completed 35,468 doses. That's 48.6% of that age cohort. In terms of second dose, we are now at 25,961 doses. That's 35.6% of that age cohort. So you can see we still have a lot of persons to cover within this age cohort. And again, we like to appeal to the parents of these persons to make sure that they bring their children to be vaccinated. In terms of the 5 to 11 age group, we have completed 6,976 first doses. That's 6.8% of that age cohort. Second dose, we are now at 2,068 doses, or 2% of that age cohort. Again, this category of persons, we have enough vaccines. We have recently received from the United States government 52,800 doses of pediatric vaccines, and we would urge persons to make sure that they bring their children to one of the vaccination sites so that they can get vaccinated. I think one of the myths that we have is that COVID really does not affect children. The numbers that we have locally would show that about 1/3 of the cases of persons infected with COVID-19 or SARS-CoV-2 would have been among children. So we have to understand that children do get infected. In some cases they might have milder symptoms, but children also, after this acute phase of the infection, some of them, like with adults, would experience post-COVID syndrome. There has been a recent MMWR report. In the US, the Center for Disease Control would normally publish what is called a morbidity mortality weekly report. And in its latest version, that's this week, they published a report where they have done an analysis comparing about 2 million healthy children with those who were infected by COVID, approximately about 1 million children who were infected with COVID. And what they found is that among children who were infected and recovered, they found that these children had blood clots in their lung. Some of them had inflammation of the heart muscle. Some of them had renal problems or kidney problems. Some of these children subsequently developed type 1 diabetes. In other cases, some of them developed type 2 diabetes. Some of the children also had abnormal heart rhythms, and in some cases, children would have lost their sense of smell and taste for a very prolonged period. Some of them also experienced prolonged periods of fatigue and malaise. So children, while most of them would recover and be okay, you would see in a subset of children that they can have these symptoms, and it's something that we have to pay attention to. Now, one of the ways that we can help to reduce this symptom burden, if you like, is to ensure that your child get vaccinated. Well, there are two things that we would normally do when we have these mass events. The first, which is rather routine, any one of these big matches that we have at the stadium, we would collaborate with the organizers to make sure that we have a health presence on the ground. So we would be in charge of setting up a health outpost, especially for players who might be injured during the match, or any patron that might have any issues. So at the National Stadium, there would be a health post that would be set up for the duration of cricket. We would also have ambulances on standby, so if anybody needs to be taken to the hospital, we'll have ambulances. Paramedics, doctors, all those persons would be there to offer any assistance if it's necessary. So that's one aspect of what we'll be doing. In terms of the match being held during a period where we still have a pandemic, I think we have to get people to exercise more caution. So there's nothing wrong if you're going to the match and you want to wear your mask, although a lot of people have now dispensed with mask wearing. But it is going to be safe, especially when you're among a lot of people, to be able to wear your mask to prevent yourself from getting infected. The version or the variant or the subvariant that is now circulating, the BA.5, is more contagious. It has been more transmissible than all previous variants. And even if you had Omicron infection before, with this variant you can be reinfected. So I think people need to bear that in mind. The other thing that is of utmost importance, if you had your first and second dose 1 year ago, then your immunity obviously would have dropped and you can get infected more easily. If you have comorbidities like high blood pressure and diabetes and so forth, you can end up with a severe form of COVID. So the better thing to do in preparation for to going to these matches would be to go and get your booster doses.